What's going on, guys? It's Patrick and Cam. We're here with friend of the show, Dr. Justin Houman, men's health specialist. We've podcasted with Dr. H a few times before, and it's always super insightful. Today, we are talking about the one, the only erectile dysfunction. I feel like we haven't discussed this in a while, and it's time to scare you guys back into shape. So, Dr. H, thanks for coming on, talking to us. How you doing?
Good. Thanks for having me back. Good to see you guys.
Yeah, I think we'll have a fun discussion. This is one of our favorite topics, and I think there's a lot of different options that people can go with when it comes to ED. But let's talk about a little bit, how does ED happen? Let's talk about the physical. Let's maybe less mental health side of erectile dysfunction, a little bit more physical.
Yeah. So well, when it comes to ED, well, first of all, it's incredibly common, right? Guys from the age of 20 to 120 experience erectile dysfunction. So it's basically something that almost every single guy will experience at some point in his life. The older we get, the more likely it is that we experience it, and it's caused by a number of things, but essentially it's due to decreased blood flow into the penis. And when you think about that, there's a number of things that could potentially cause it, and because there's so many different things that could cause it, the treatments vary as well. But the one good thing is, if you are experiencing erectile dysfunction, this is one of the beauties of addressing these types of issues, because I guarantee you we'll find a treatment for you some way, somehow. So it's satisfying in that way from our standpoint.
Right. So we talk a lot about how erectile dysfunction can be a precursor for heart disease on the show. It's a lot about almost scaring people into be like, hey, if you want, you got to take care of your heart, and it also, you take care of your penis as well.
Exactly.
And so they kind of work hand in hand, as odd as that sounds maybe for, our regular viewers, but it is very important that we take care of our heart. And by doing that, so in your experience, if you have a patient coming in and they're early on in experiencing erectile dysfunction, are there some natural, ways that you can recommend, say like, hey, we can try this before we start moving on to more intense therapies?
Yes and no. I guess it's all in the context of who you are, how old you are, what your current medical, your health, what your current health is, those types of things. What can anybody do to basically help preserve their erectile quality, their sexual function, all those things? It's like you said, right? It's anything that's good for your heart is good for your erection. So in simple terms, it's eating well, making sure you have a well-balanced diet, and that helps prevent high cholesterol levels, diabetes, high blood pressure. All of those negatively impact your erections. Sleeping well, which is very important for your hormonal function. We all know testosterone is very important for erections. And then finally, exercise. And exercise is good for both for your hormonal health, for your stress levels, and also in order to prevent all those high cholesterol, diabetes, high blood pressure type issues. So those are the three things I would recommend for anybody who wants to either, delay the progression of this, because we're all going to experience it at some point, or if they are experiencing it, what things they could do to help optimize their current function.
Right. So that definitely makes sense. And also like the exercise is going to help with the vasculature and keeping it like that elastic. You don't want the arteries to get hard.
Exactly.
Essentially. And so like the hardening of the arteries happens. And from how I understand, and correct me if I'm wrong, please, but the artery or your vasculature that leads to your penis and the vasculature around your heart are very similar in like structure and things. Like the penis is a lot smaller. But I've just heard that the structuring of the vasculature in those areas is very similar in how it works. There's sphincters and valves and all kind of stuff that are, keeping blood going in and out.
Exactly. So if you think about it, the same arteries that provide the heart with blood, those are the same arteries that provide the penis with blood flow for erections. However, the ones for the penis are much smaller. So these things that we talked about, like diabetes, high blood pressure, high cholesterol, these are the more common ones. What they do is, if you think about the artery, the inside of the artery, it's, if you're healthy, it's wide open, right? You're getting ton of blood flow in that forward direction. However, these types, high blood pressure, diabetes, cholesterol, what they do is they thicken that wall, and over time it narrows the lumen of that wall, and therefore less blood flow is going in. Less blood flow means weaker erections. So to my previous point of the penis, the penile arteries, the arteries that are involved in erections, those are much, much smaller. So the impact of a smaller of less blood flow, it's more noticed for your erections before it's ever noticed for your heart. So in simple terms, what I'm trying to say is, if you are, basically erectile dysfunction is usually one of the early signs of poor overall health. Whether it is diabetes, high blood pressure, high cholesterol, maybe it's even having low hormone levels, low testosterone levels. That's usually the first. So if you are experiencing it, it's easy to, to say, hey, it's okay. Like, it happens to everybody. But if you are experiencing it for long periods of time, make sure you get evaluated by a doctor, because this could be, it's like this, it's like a check engine light sign that comes on.
Sure. And then I've also kind of noticed, in our classes and talking to other docs and things, is like the loss of the morning wood. You lose your morning erection. Now, what would you say, like, what's a place where maybe you would tell someone, like, obviously most people, I'm 35, I don't wake up with a morning wood every day, but I have it definitely a few times a week. At what point would you say, like, I know they got a little personal, but what would you say, like, is like a time where someone might think like, well, maybe I'm not like erectile dysfunction in like the bedroom, but I've lost my morning erection. Maybe my erections are a little bit weaker, things like that. Like, is there a sign to go get checked, or, could it just be stress, those kind of things that would impact a patient?
Yeah, I would say there's no right answer for this, right? There's no like hard criteria to say if you're experiencing A, B, and C, you should go be evaluated. But in simple terms, if you're I would say, morning wood is, I'll say before I say what's important, I'll talk about morning wood here. It's not always like, you don't always have to be waking up with morning wood, because you're that's happening during a particular sleep stage, and some people wake up during that sleep stage and some people don't. So I wouldn't necessarily say that's the most important thing. I think earlier when we were all young, our hormones were raging, so we're always waking up with morning wood. That's different. As we age, you're not waking up with morning wood as often, which is, again, that's completely fine. But the reason to be evaluated, or the reason to seek evaluation from a patient standpoint when it comes to these erections, I would say, is if you're really having unsatisfying erections to the point where sex and sexual activity is basically not satisfying for you, or your partner, right? If you're content with your erections and your or the way things are, that's fine. But if it ever leads to the point where it's just not what you want it to be, then that's the time to seek evaluation. So it's a little bit more subjective than objective.
Oh yeah, I think that's super important, because for me, boot camp was 3 months long, and that entire 3 months I never saw my erection, and I didn't see no other erections too, which is a damn good thing, because we all shower together in a gigantic room. So last thing I want to see is a bunch of hard rocking cocks out there. So you're saying though, match that kind of situation with a performance issue, or maybe even just a lifestyle issue, and that's the point where you want to maybe go get evaluated. Would you want to see a specialist at that point, or would you want to maybe see your primary care first and then see if you get a referral to a specialist?
I mean, I would say see anybody. I think it's probably easier to see your primary care doctor. So, I mean, I would say basically see a urologist or a PCP or a primary care doctor, right? One of those two. Either one. They could at least provide some clues. You may ultimately need to see a urologist to really do some good deep workup potentially. But the key is, you don't want to, I see a lot of young guys who, at the age of 21, 22, they're experiencing erectile dysfunction, more so from the mental aspect. It's not really a health issue. The machinery works fine, but it's more of a mental thing. And then they're spending hundreds of dollars a month on these online websites, Romans, Hims, buying Cialis and Viagra. When in reality, there's a good long-term solution to this. So rather than masking, these things are just band-aids, right? You want to find a good long-term solution for these issues that you're experiencing. That way, not only are you saving money, but more importantly, you're preventing the progression of this, and ultimately you're delaying the, you want to have a happy sexual quality of life, especially when you're young. So be evaluated. It's easy to do.
Sure. So when we're kind of I'm thank you for kind of bringing that up, because it was another topic. It's easy to talk about the lifestyle modifications that need to go into a physical issue, but the mental issue, especially with young guys. I mean, I heard it on a radio station a while back. I think we've done a couple podcasts on it, but the amount of porn that's accessible to young men is crazy, because it's really desensitizing the brain from what a true sexual experience should be. I mean, they're actors and actresses doing their thing. And also, I mean, just stress. And I think that for guys, when you're watching the news, or not the news, but just like commercials or football game or whatever, it's like, just like you said, it's advertisements for Hims, Romans, all those things. And it's like, we're so focused on the dick pill aspect of men that there's so much more that goes into it, that these medications might not really help you if it's a stress induced or psychologically induced erectile dysfunction, more so than the physical end of it. I mean, in your experience, how are you seeing patients that the machinery works, but the brain doesn't?
Yeah, I mean, there's always these these scenarios where guys under the age of 30, there's something physiologically wrong in very rare situations, but like the machinery really doesn't work, and that's for a number of reasons. Sometimes it's the anatomy is off or whatever. Don't get me wrong, there are some scenarios like that, but the broad majority of young guys who are experiencing erectile dysfunction, it's usually a psychological thing, right? It's in their head. And it's a number of things. I mean, one thing is like what you said, pornography completely messes with men's expectations of reality, amongst other things. I mean, that's pornography, the way it is these days, is it's only going to get, I mean, it's only becoming more and more graphic and more realistic. Therefore, I think that it's going to affect young guys' sexual experience significantly. The other thing is stress and alcohol. So I'm sure we all heard of like whiskey dick, where you have one, you go out, you drink a lot, and then you try to perform, you're unable to perform that night. Then the next time you're trying to perform, you think about that previous night, and then even a little bit of stress hormone causes erections to go down that second time. And then it becomes this cascading, like this vicious cycle. One leads to two, which leads to 20. So, and again, these are all like basically mental, right? The blood flow issues are normal, the hormone issues are normal, but it's the mental aspect of it. So it's very, very common in young guys to have that we call it psychogenic erectile dysfunction, where it's in your head. It's in your head. And there's ways in which we could fix it. There's no question about it. A combination of, it's not just your physician, but therapists, sex therapists. There's different, it's like a multidisciplinary approach to dealing with it. But you have options, and a lot of good options to address it.
Yeah, that's interesting, because I don't think that's something we really touched on too much on the podcast. I don't know if we've talked about it, Cam, but the psychological component of ED.
Oh yeah, we definitely talked about it a few times. We had our good boy Bill on there talking about the effects porn on your mental health and things like that. And that definitely is something that I've experienced, especially with like a lot of young people. There's a lot of guys in the military who are using the quick fix with the pills and stuff like that, just get around that. But I'm sure it's not just porn. It's also, we drink a lot. It's a very high testosterone stress environment. So there's a lot of that mental aspect weighing down, because you're guaranteed at that point, it may not be the absolute perfect. We're at pretty much peak physical health, while you're in the military. You're constantly exercising, you're constantly moving, you're constantly performing in other areas. So you definitely don't get that chance to have that, the cholesterol, diabetes, and heart problems that causes it. So it kind of does show a lot of the impact mental health can have on this, and kind of create this system where we're looking for that fast fix, because we're not going to go talk to our docs, we're not going to talk to corpsmen about this, just because it's embarrassing in that situation, especially when you're young. I guess it's still just as embarrassing when you get older as well. Kind of a psychological aspect everybody kind of struggles with.
Yeah, I mean, it's like taboo for anybody, right? Whether you're 20 or 80, it's still taboo. If you're, I guess the older you get, a little bit more comfortable you get with the idea that, this is becoming more common. But if you're a 20, 25-year-old and you're having problems with erections, like, you don't want to talk to anyone about it. whether it's your friend, your father, your doctor, your therapist. It's a tough thing to talk about. So, and that worsens it, right? That makes it even worse because you stress more about it because you're not talking about it, you're not seeking help. So yeah, it's a and I think, to your point again about pornography, I think it's going to become more and more prevalent, no question about it.
Well, I definitely noticed it even in pharmacy school, where young guys were getting prescriptions for, sildenafil or Viagra. And you're thinking, dude, you're 25. You don't need that.
Yeah.
And you realize you can do a full workup on them, and you're talking to them and you find out that they watch a ridiculous amount of porn.
Yeah.
And you get to a certain point where things are not enough. And to get that kind of dopamine going, you have to get more and more graphic. And then when you're with a regular partner, like a regular girl's like, I'm not doing all that, so it's like,
100%.
like,
Yeah.
what do you want me to do? So I think that's kind of thing, is that you're so desensitized to the sexual experience, and that actually having, your partner or whoever in front of you, that you're just like, oh, what do I do? Because this isn't what I've been watching, and this isn't what and unfortunately, I think, maybe I would get off topic for 1 second, but the sex education system isn't great. I mean, we're not necessarily taught in school, and it's embarrassing a lot of times for parents to have that discussion with their kids. So where do you go? I mean, where do you think that you have to go? Some people, their sex education is based on porn, and rather than, talking to a sex therapist or things like that, and getting a good, robust knowledge of what a sexual experience should be.
Yeah, that's a great point. I mean, we could probably be a lot better about educating. I don't even know when it's sixth grade. I forget what, fifth or sixth.
Yeah,
when
I had mine in fifth grade.
Yeah,
when sixth grade.
Sixth grade. I think that's when, I mean, you could really. It's so taboo, even for public institutions, private institutions. It's all taboo to talk about these kinds of things and educate young guys about it. And we kind of, let guys go out there and fend for themselves. Like, hey, just figure it out on your own.
Yeah. I mean, my sex ed teacher was like a 60-some-year-old man, and he looked like he hadn't had sex in a minute.
Yeah.
It's like, well, let me show you how to put the condom on the banana. It's like, do you even know how to do this, dude?
You remember there was a movie where the I think it was called The Girl Next Door with I'm talking about, where at the end of the movie they created a new sex ed film, like a video for young people. Do you remember that?
Yeah, I do.
I'm surprised no one actually has done that up until this point. I'm sure there's a lot of barriers to it, but that's an idea. It's definitely an idea of how to educate young guys.
Yeah,
the only video I remember was like a cartoon they played for us, because the guy who taught us sex ed looked like Andy Reid. He had that big old pot belly. Haven't seen his dick in years. And it was like a cartoon video about, it's okay to play with yourself. So basically at that time I was like, oh shit, I go home and yank on this thing. Let's fucking go.
I think I'll give her a shout out, because she's been awesome on the podcast, just like you, Dr. H, but Dr. Tara, I can't pronounce her last name to save me, but she's been featured in a lot of stuff, and she on Instagram and YouTube and stuff, she's doing it can get a little racy, but she's actually doing some great sex ed stuff.
Where a pharmacist?
No, she's like a professor at Cal State Fullerton.
Okay.
And we were going to go out there and podcast with her this year, and we push it back to next year, just because like the holidays and all kind of stuff kind of happen at the same time. But she just, I think she's just like a professor. I think she has a doctorate, and
she's a PhD.
If she listens to this, and she'll be like, you guys are all wrong. But yeah, basically like human communication and sexuality and things like that, like a class that she teaches. We podcasted her about teaching it. It's like almost, and then what she's doing on social media is like really empowering people to explore their sexuality, but safely. And then also educating people on different aspects. So I think the other day I saw a clip of her. She's like talking about polyamory. Some of it's stuff that people would probably never consider, but she's bringing it to light and really kind of breaking a lot of stigmas about sexuality. So shout out to her for doing what she does. And we talked about it with her on the podcast, Dr. Tara, you're actually educating people, not this weird sixth grade, only way to go is abstinence kind of thing.
Interesting. That's actually it's honestly a great idea.
Yeah.
It's honestly a great idea, because Yeah, the education system, at least for guys, I think I don't want to say it fails us, but it doesn't give us a lot to work with.
Yeah. So let's transition on over to treatments. So let's talk a little bit about our treatment options for let's say general erectile dysfunction. I think there's probably a lot more to go into than what we have time for the podcast. So we kind of talked about psychological ED. It's going to take that multidisciplinary team. You're going to have to talk to a sex therapist, a therapist, maybe get some medication intervention to kind of help move you along until you're back. So, what are your first line treatments that you go to when you have a patient coming in with, like, we'll just say typical general ED?
Yeah. So the way I like to break it down is there's three mainstays of ED treatment. And the way to think about it is you could think of it the three P's. It's the pills, the pokes, and then the prosthesis. So everyone starts at the bottom and they work their way up to the top. So at the bottom, it's the pills. The Viagras and the Cialises are what we all are relatively aware of. And this generally, I'm not talking about young guys, but let's say guys who are 40s, 50s, and older. This works for about 60 to 70% of guys. And they work well. The Cialis generally works for a longer period. It lasts for about 24 hours. It takes a little bit longer for it to kick in. A Viagra is a little bit shorter acting, but take it within an hour or two before intercourse. The key with Viagra is empty stomach. But anyways, these all work, for the most part, for about 3/4 of guys. When these don't work, we go to the second thing, and that's called the pokes. And these are we call these intracavernosal injections. So the penis has erectile bodies, the cavernosal bodies, and if you think about, you're basically injecting yourself with, think of it like liquid Viagra. Basically helps dilate the blood vessels in those erectile bodies. Blood flow comes in, gives you a strong erection. The idea of injecting yourself for a lot of guys is incredibly taboo, but you're using a tiny insulin needle, so it's you barely feel it, if you feel it at all. Once you break the taboo of injecting yourself, I have plenty of patients who are on it for 10, 15, 20 years and they love it. It's you inject each time about five minutes before intercourse, gives you an erection. It lasts for a whole orgasm. And then if those don't work, then we talk about the gold standard for erectile dysfunction. This is the penile prosthesis. And this is it's a game changer. We've been doing this for decades. It's not a new device. The device is being upgraded every couple of years in terms of different features on it, but we call it a 3-piece penile prosthesis. Essentially, the way it works is you have 2 cylinders. Actually, I have one right here. Let me grab this for you and show you.
Oh, nice. Getting a live demo.
Yeah, right. I was working with this junk app, be like, check this thing out.
I'll tell you, it's cool. It's pretty, guys love this, and it's a pretty common surgery. I probably do maybe two or three of these every week. So this is the device here. So these right here are the cylinders. Okay. These are the cylinders. They're flaccid right now. This is the pump. So these sit in your penis. This sits in between your testicles in the scrotum, and this reservoir sits in your lower abdomen. So this is fluid filled with saline. Every time you want to have an erection, so all this is contained in the body. None of it's sticking outside. So every time you want to have an erection, you squeeze the pump here, and the fluid from the reservoir is going into the cylinders here, and you'll see over the course, it probably takes maybe 20 pumps, but it gives you a super strong erection for as long as you want. And then, you guys aren't here to feel it, but this is it's you can put holes in the drywall. And then there's a release
Cox right there.
Yeah, guys love this. And then there's a release valve here. So what you do is when you're done, you just squeeze the release valve, and the fluid from the cylinders goes back into the reservoir, and then you're done. The surgery is pretty straightforward. It takes about an hour. And then the recovery is anywhere from 3 to 4 weeks, and you're able to start having sex.
Wow, I have so many questions. We'll get to the bottom of the pyramid really quick and just play the high notes right here. So I have a lot of questions about this other stuff. I'm learning a bunch. So just to let our viewers know, generally with the Viagra, Cialis, it does come with somewhat of a side effect profile. So, You might like experience flushing, low blood pressure, always contraindicated with if you're taking nitrates for chest pain. So that's definitely something to discuss with your physician.
Yes.
Just because you can have what we call profound drop in blood pressure and it can be fatal. So just so that, that's kind of baseline. I think most people can look up, what the Viagra Cialis does. It just opens up, it helps, release some chemicals. It opens up the blood flow. You got your blood flow going. And generally, like, I'll be forward about it. Like when I was a little younger, I tried like a recreational sildenafil like packet just to see what it did. And I feel like maybe it was just because I was younger and healthy, but I feel like it was, it lasted like for longer than one orgasm. Like you would be able to sustain that erection again a couple times, but that could have just been my experience.
Oh, see, you were responsible with it. When I was in like middle school, I lived in Jacksonville at the time, and then one of my friends were staying like a weekend at his house or whatever the night, and his dad had some, so we like cut some up, and we all tried like a third or a quarter or so one, got erections, and then because you're young dumb kids, we just went streaking through his neighborhood with fucking boners. No real use for it. We were just being hoodlums.
That's so funny. Most kids go out, they start doing, crazy things like drinking, whatever. You guys are walking out doing Viagra and walking out on the streets.
Yeah, just being amazed. Like, look at this rock hard 8th grade penis.
Recreational NFL. That's
recreational erections, my man.
I think, I'm not going to say every guy, I'm not going to put us in, but I think every guy is curious, like, what does this do? And when I was in my late 20s, I definitely gave it a whirl. I've only done it once, but it was just like, what an experience. Like, it was pretty crazy. And I didn't really have any control. Like, I was popping wood just like a few minutes after I took it, and it was just like, wham. And for me, it lasted, I think I did a sildenafil packet, like it was a jelly pack. And I think it lasted for like 3 or 4 days. Like I just had a rager for almost like it wasn't continuous, but it was just like up and down, up and down, up and down. So, in case anybody wanted to know, that's my experience with recreational sildenafil.
Man, that'd be a way to make some money at the sperm bank right there. You just sit around popping loads all afternoon.
But yeah,
the one misconception about it is, you're gonna be walking around with erections.
That's not true.
It's not true. It's like when you want to have one, you'll go 0 to 100. But if you don't want one, you're not walking around with anything.
Yeah. So, but I think that's a pretty good comprehensive view. If anybody has any more questions about these, they can always reach out to us or Dr. H, I'm sure. So let's move on. I want to talk about these tiers of therapy because this is pretty interesting. So you have the injections. And you said that a lot of your patients do feel a little bit stigmatized because they are injecting their penis. Is it right into, I guess, for lack of a better term, like the shaft, like right into the blood vessel? Or where exactly is the injection going?
It's going, so basically I don't have a model here, but the penis itself is comprised of, there's 3 components to it. If you do like a cross section of it, you have the 2 corporal bodies, those are the erectile bodies, and then underneath it is the urethra, and that's where you urinate out of. So everyone feels the urethra on the other side, on the underside. But in order to inject, you can't just inject into the skin level. You really want to inject it into those bodies, which it's not too deep, but it's not that deep because the penile skin is relatively thin. But the idea is you just want to get it into the corporal body. That's it.
So is it like a direct 90-degree, like just into it?
Yeah, so we say inject at 3 or 9, right? 3 o'clock or 9 o'clock. So right at those, and you switch. You want to switch from side to side each time, because over time, what happens is, and some guys it's worse than others, but what happens is, the idea of injecting or putting something into your penis, your body responds with inflammation. Inflammation in those corporal bodies over time is not good, only because what it does is it creates scarring. So that very spongy, smooth muscle that's supposed to expand and contract during an erection, it starts to scar down. And this takes years and years and years and years. But over time, these injections, they could worsen your erectile dysfunction significantly. Or I wouldn't say significantly, but they can worsen your erectile dysfunction. So they're a good long-term solution for many guys, but some guys at some point, they're like, all right, they're not working anymore. And that's when they talk about the prosthesis.
Sure.
Okay, so it's kind of a similar risk with a lot of injections, because I know like in insulin and then even some of these new like GLPs, the same thing. You have to rotate sites just to prevent that scar tissue. Because the last thing you want to do is find something that's working, and then you end up Mickey Rourking your dick.
Yeah.
Yeah. I was just gonna ask that. Like, is it a rotation kind of thing? Are you doing like kind of one side and then the other and just moving that side around so that
Up and down.
Yeah. So that it can heal.
Back to back. Exactly.
Excellent.
Exactly.
And so one last question about this, unless Cam has anything, but what is like, are we talking, is there a side effect profile here? Like what we take an oral, I know an oral pill, it's going to go kind of systemically, it's going to go all over. Now we have a targeted area that we're working on. And I know you kind of mentioned it. I know it's a different like kind of drug than sildenafil and Cialis and things. But is there something like, would guys feel, is this contraindicated with nitrates? I mean, what are the things that we should know?
Well, generally, it's very well tolerated for most guys. The only thing is you have to be careful in terms of dosing it, right? So there's different ways we play around with it in terms of not just the dose, in terms of like the volume that you're injecting, but the concentration. So there's different components that we use. Sometimes we use a single component of prostaglandin. Sometimes we use two components. We call that bimix, which is a combination of different components. And then there's something called trimix. And now there's something called quad mix, which is 4 different chemicals. But essentially all these things, all these chemicals, the way they work in different ways in order to dilate the blood vessels. Now, so the thing that guys always have to be careful, and this is something we're very mindful to teach them, is don't use too much, because you could get a priapism, right? Remember, like, those commercials where they say if you're getting an erection lasting longer than 4 hours, see your doctor. So there's guys, especially here in this part of Los Angeles, who they'll inject themselves on, they'll go on a weekend bender having inject themselves with large amount. I'm not even joking. I mean, when
I know.
When I was a resident, man, these guys would have priapism episodes for like 72 hours, and then they show up like on Monday night after having like having fun all weekend, having an erection for literally it hasn't gone down for 72 hours, and then it's a mess. It's a mess where their chance of having a spontaneous erection ever again is very, very low. So the key with these is, if you, I guess really in simple terms, if it's lasting longer than 4 hours, either go to the emergency room, call your doctor will probably send you to the emergency room, but you got to be evaluated.
Yeah, I saw a guy on rotation one time that had it. He had priapism. He came in with priapism, and it was in the ER, and they just pulled the blood out.
You're literally pulling blood out of the penis. It's not dead, but it's just deoxygenated. It's like purple blood just coming out.
Mm-hmm.
I love urology, but that's one of those things of urology where just you can't pay me enough money for that.
It's one of those things you walk in and you're like, fucking gross. Like,
You just
keeping with that, with stabbing the penis with things, what would be the concerns with like keeping it sanitary, cleanliness, and things like that? Because you're creating a hole essentially that leads inside. Do you recommend that the patients, are they wearing condoms? Do you need to like alcohol swab it afterwards, after the intercourse, or anything like that?
What you mean swab clean, just in general cleaning their penis?
Oh, after like using the injectables.
Oh, yeah, you'll alcohol swab it before, just on that area of the skin, and then we usually say just put a little bit of pressure, like put pressure on that area, especially if you're on blood thinners or anticoagulants. Just put some pressure there for 30 seconds to 60 seconds. That helps with decreasing any bruising or inflammation or swelling. But yeah, it's in terms of sterility and that just alcohol generally does the trick.
Well, I mean, more so for like, for like the sex itself, because it's not always is it going to be, the cleanest environment for the penis to be in. So is there like an increased chance for infection or, transmittal of STDs, or what they call them, STIs now?
No, not at all, actually. Because so the thing is, like, if this is you're putting it at the base, you're really going as close to the base of the penis. You're not like going at the tip. So that part of the where we tell them to do it, that part, I mean, it's not even, if it even gets close to the wherever you're inserting it, it's not generally not getting in there anyway, whether it's the anus or the vagina. It's not really getting in. It's so close to the body that it's pretty protected.
Okay. So don't go balls deep.
Don't go balls deep.
And then, so as we kind of, I'm actually familiar with the trimix that you were talking about. That was kind of something that I've seen. I didn't know about the quad mix. As far as like the dosing of those, like, do you generally start with like the 1 or 2 chemical mix and escalate up?
Exactly.
Or could you just be like, hey, I think, this is what's available. This is what might work for you. I mean, are there stages to the injectables?
Yeah, so this is the part where it's purely stylistic. Different doctors will tell you different things. Yeah, the way I like to do it is start slow and work your way up. Because you're preserving, you're giving them if you start off at trimix, you're limiting yourself in some ways. I don't want to say it's a bad idea to start trimix, but just from my standpoint, if you start at one component and they do well on it, just keep it going. Let's say 5 years from now, they're not responding well. All right, you could add a second component. You slowly work your way up through that one. So you're basically prolonging the duration in which this could work for them. And again, this is purely art. This is not scientific by any means. And I think everyone has their own style.
Sure. Yeah, I figured it was kind of something along those lines, but I know with medicine in general, you kind of want to escalate therapy instead of like, hey, I'm going to slap you on the quad and send you, wherever you got to go.
Right.
Yeah, and sure. And then so kind of the last component of treatment is we saw that you had the implant and a second ago. We'll get this video out on YouTube so people can kind of see the demonstration. By the way, Dr. H has a great YouTube channel. We'll cover at the end where you can find all of his stuff. Very educational, very informative as well. But so you have this implant. It's a surgical procedure. Now, I was curious when you were showing us that it looked like basically a couple of valves. Now, are these valves replacing the artery, or are we just kind of moving them out of the way? I mean, how exactly is this implant kind of going in order to put the hole in the wall? Was it the hole in the drywall?
Drywall, my guy.
Yeah.
I mean, so the way we do it is there's a single valve, right? But basically, you saw those these cylinders that here, these fill in the erectile bodies. So all that the spongy tissue that's in those erectile bodies basically gets pushed to the side, so these fit in, right? So these basically replace those, and then the device itself just has a single valve that goes, either fluid goes into the cylinders or out of the cylinder, so up or down. So basically, it's just one moving component to this, and that's why it works well. It lasts anywhere from 10 to 20 years for most guys. Every once in a while, a guy will be super aggressive about it. The device will break, and then you have to replace it. The main risk associated with this surgery is infection, because you're putting a prosthetic device in the groin area is not the cleanest. So, if you're doing these a lot, you'll have a very voodoo technique, and your voodoo in terms of how you like the way I do it. I have patients buy a certain antibacterial scrub, use it a couple of days before the surgery. I give antibiotics before the surgery, during the surgery, and then even after the surgery, just to make sure there's no infection. But yeah, it's a great device. I mean, I'll tell you one cool thing about this thing. Actually, one of the companies that makes this is they're replacing the pump, and probably in the next 8 years, they said by 2030, it's going to be Bluetooth activated. So this is gone. So basically,
awesome.
Yeah, with your phone, with Siri, with Alexa, whatever you want to do, you could basically activate your erection.
That will be the greatest thing in the world. Like, I'm sure you've seen the videos of how like girls have like those vibrators that they'll pop inside and you control them on your phone. They'll have the opposite, but you'll just be watching like Titanic or some shit, and they're like, "Hey, Google, give me an erection," and they'll fucking fire that shit right off on you.
Make sure you don't lose your phone. Make sure, your phone doesn't get hacked.
My heart will definitely go along with that. But the rest
guys love this. I can't tell you, guys. This guys absolutely love this thing.
They do, and like I have a little story to attest to that. So during our rotations, I actually got to do infectious disease with a large government group. I'm not going to give any types out because it's not here or there. But we had a patient with that who was consistently just getting continual infections down there. He would come in and it would just be tore all up. and he was just so adherent, like he is not taking this thing out. And like they tried to like replace it, and he was so far against that was pretty much just coming in, debriding what we could, get it back together, and then just dosing him with just high, like Penims and kind of like high level antibiotics.
Yeah.
He wanted it so bad.
He loved it, right?
He loved it.
Yeah,
I was like, you gotta give it a break, because it's obviously your body's not ready yet, but he just loved that thing.
Yeah, it's funny. Like I help, a large part of my practice. I do men's health, so I do fertility and then sexual health. I help, help families have babies, right? But if I showed you the emails, like the most thankful emails come from people not who have had babies, but people who have had this device. They love it. They love it. It's like a complete game changer for them.
It's ingrained into our entire psychosis. Like it's like our dicks are our lives.
Yeah, exactly.
And then like it's just like you're like Kyle, just punching holes through the drywall. With that device. So I did have a question about that. You said that there's a saline mixture in there. Does the saline mixture have to get replaced? Is there anything like that, or it just stays in there because it's sterile and it just
so it's isotonic. So it's basically isotonic with the body fluid. So it never really it doesn't shift. Unless there's a leak in the device, and very, 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 very rarely is there a leak in the device where it has to be replaced or redone. But it's a great option. It's a great option for guys. Like I have a lot of patients who, I don't want to say a lot actually, but there's a handful of patients who are like, damn man, like why didn't you tell me about this 10, 15 years ago? Like this thing is awesome. Like I really wish I knew about this 10 years ago. Like it would have changed my life.
I think with that would come to be a question like, would it really be a good option for them? Because 10, 15 years prior, they may be in a more of a situation where they could do lifestyle changing or do other things that would kind of be the step before you'd go to surgery. Yeah. So while it may be, revolutionary, I still think it's got to have its place kind of more top that pyramid.
Exactly. Yeah, this is generally, 55 and older, but generally even older than that. But the youngest, it's hard, you'd be hard pressed to find a lot of guys under the age of 50 who are doing this.
Yeah, that was the case for the patient we had. Is he was over 65, and I think his issue was that he was wearing adult diapers, so he had a little bit of incontinence, and that was just just a horrible environment for that situation. But he did not care. He was like, this thing is staying in place.
I love this thing.
That's amazing. Well, Dr. Houman, thank you so much for coming on Men's Health Unscripted. It's always a great talk. Tell our viewers where they can get a hold of you or just see some of your content. Like I said before, his YouTube page is awesome, very educational, very to the point, and easily digestible for anybody to listen to. So what do you got, Dr. H?
Yeah. Well, thanks for taking the time, guys. But if you guys want to look me up, Justin Houman, MD, Houman. You can look at my website, Houman, MD. There's a newsletter you could sign up for where I send out useful, important information about men's health topics. I'm on Instagram, Twitter, YouTube, like you mentioned. But yeah, if you guys have any questions, my information's online. You can reach out anytime.
Awesome. Yeah, we've been just like a side note. I think I've been going like for a little bit more holistic route just to see guys stay away from the gas station dick pills. Like, know what's in them. I probably should have said that earlier in the podcast, but like you just really don't know what's in them. A lot of them, if you are taking nitrates, like some of them sneak in small amounts of like the Cialis or Viagra, so they can potentially be dangerous because the label will say one thing and then you'll be getting a different product because they want it to work. It's not really regulated. And
it's not at all regulated.
That's wow, they're like, oh, I got a crazy erection. And these guys don't realize that like they're actually taking Viagra and eventually can get desensitized. So that's kind of
happened to Lamar Odom.
Oh, really?
Yeah, I think he was taking like horny goat weed from the local 76 gas or the local gas station.
Oh wow!
I'm gonna get you that horny goat weed.
That horny goat weed sounds great, doesn't it?
Yeah, I actually recently saw a study on ashwagandha that there was like good benefit for erection, but it actually over a long period of time without a drug holiday can like elicit like serotonin syndrome or something very similar because it dampens that receptor. So if you're not taking a drug holiday for, I think it was like I think they want you to take a drug holiday like every 90 days, take some time off ashwagandha. Because it is good for erections, it's good for blood flow, but it's dampening one of the serotonin receptors, and it's actually like desensitizing certain aspects of people.
Very interesting.
So yeah, that's your men's health fun fact. Thank you so much. I really appreciate you taking the time. I know you're a busy guy, and keep doing it, man. I love watching your stuff on the internet.
Likewise. Yeah, well, let's do it again. We'll do another
Oh yeah,
one.
definitely. Stay hard out there.
Amen. Get up and stay hard.